Welcome to the webinar, which is going to cover Episodes of Care in Infinity. Episodes of Care is a virtual screenshot of what is happening with patients while they are in your care within the hospital. And to access the Episodes of Care, you'll find that module under Medical Records on the ribbon and Episodes of Care. And I already have it open up here on my screen. And I already have some patients that I've added to the Episode of Care. There are a couple of ways to add patients to this screen, to Episodes of Care. And the easiest, well, there's a couple of easy ways. I'm going to go ahead and select this miscellaneous pet. So I have my active patient. So to create an episode of care for this patient, I can simply come up here on the ribbon and click Add Active. And now I have an episode of care started for this patient. As we look at the episodes that I have here on my screen, they're all in the collapsed mode. With a quick overview, what I can see is that I have some checklist items that are not complete yet. So for example, I'm pointing at Lennox. Lennox has 3 checklist items that must be complete. Others have 1. Here's Nemo has 2 checklist items that must be complete. What that means at a glance is that before I can close an episode of care, those checklist items have to be marked complete before moving on. And we'll take a look at those tabs in just a few minutes. At a glance, when I look at the status in this collapsed mode, I can see, for example, if there's an open invoice, if there's an estimate out there, when it was started, if there's the visit reason. So you can see on a couple of these I did start those. I entered in, I'm using Clinic Census, so here I can see where Nemo is currently located, what the status is for Nemo, reason for the visit, and when the episode was started. The same thing down here. I've got Rusty, I've got some basic information, little more information here with Tank. He's the one I'm really going to use in my example today. And we also, there are more tabs, but what I can see at a glance, the status, checklist items that need to be complete before an episode can be marked closed, and currently who's working on this patient, the providers, and if there were any referrals, they show up here as well. So I had an active patient. I did an Add Active to create an episode of care. You could also click the Add button, which brings up the search screen so you can search for the client and patient and then create an episode of care that way. I have an option to delete an episode of care. However, again, I have my episodes of care set up to automatically create a default checklist item. So before I can really delete an episode of care, again, I can't have an open checklist item to just delete one. But that's nice if you don't have it yours set up that way. Let's say you inadvertently make an episode of care for a patient, then you can delete it to remove it from the screen. There is a report that you can print, the multi-patient report. So this is just when you see there were no parameters. This just shows me who has an episode of care out there and some basic information about their status. My current patient is this miscellaneous sales canine. If I select another patient, then I can make them active by using the buttons here. Make them active. And then if I want to open the dashboard, I have quick access to open the dashboard from this module here. Well, let's take a look at another way of creating an episode. Well, let's take a look at an episode of care. Let's do that so you have a pretty good idea of what really is going on. And I'm going to start with Tank. I'm going to just double click to expand Tank's episode of care. So here's my close episode button. So again, I can't close the episode until I have the checklist marked complete. But again, from the status tab, I get information about Tank. Here's a checklist item that I would like to complete. So I have it set up by default that every patient who comes in gets an episode of care, and I want a wait. They can't close the episode until they enter in the current wait for the patient. Now over here on the right, I have additional buttons. So if I want to add canned checklist items, I have, for example, here I want to do an MR soap. So I'm going to go ahead, save and close that, and add that checklist item. And we'll go through the setup screen so you can see where you can create your own checklist items. If I want to just manually add, I can click the add button and then type in, maybe I want to do a CBC. Caps lock is on. And I'm going to save. I can do a save and close, or I can just go ahead and do save and new if I want to create other checklist items. There. So those are checklist items, which again makes sure that this episode remains open until these things are actually checked off and marked complete. For the providers and referrals, you can manually add. You can also remove any providers and then any referrals that anyone who may have referred this patient. Otherwise, as I create an invoice and a provider is added, or if I create the medical record soap and select a particular provider, their name will get added to this screen automatically. So again, what we're looking at is, okay, I want to check with Dr. Lisa to see how Tank is doing, or what her role was with Tank and what's going on there, if I have any questions. So again, the episode of care is giving me an overview of what is going on with this episode. As far as, there was a question out there, can you have multiple referral sources? Absolutely. You just click add, and from your list, add as many as you need to. So you can see from existing referrals or from all clients. We'll get to the invoice part. There is a setting. So there was a question out there, can you set episodes of care to not allow an invoice to conclude until the checklist is complete? Well, there's actually an option in episodes of care where you can automatically close the episode when you conclude the invoice, but again, you can't close the episode unless those checklist items are complete. So that's how they have it set up. So we'll take a closer look at those settings. Here are the appointments that are currently set up. And I do want to point out again that for this episode of care, this is when it was created. Today, basically. I created it this morning. So it's only going to show me really what's current, which is the benefit, one of the benefits of this episode of care as we look at the history later on. So if, let's say, I have a question about how Tank was treated, what was done with Tank during his surgery, during the time he was with us, rather than searching through all the medical record history, especially if it's now going to be months or a year out, I can just search through the episode of care history and look at just what happened when he was in our care during this time. So here's the appointment that was made for Tank. I did have a couple of estimates out there under Tank's name, and what I did is I selected this estimate, which then showed up on the status type. Users can click this little browse button and enter in a low and high value for an estimate. But again, what I did was simply check an existing estimate that was there for Tank. I do have an invoice started, so here's what I have on the invoice for Tank. And when I go to medical records, I have a slight pause there. So here's what's been going on with Tank since his arrival today. So I have a couple of items on the treatment plan. The invoice is started. I started the soap. Now, again, this is a virtual screen, so you can't make any changes, but I can view. So here I can expand the soap. I can expand this image, but I can't make any changes to the medical record through this screen. I know that how one clinic has used this is the staff can anticipate what the doctor needs. When they open the episode of care, they can look at medical records, or they can look at the treatment plan for the patient and anticipate what care the patient needs coming up, or maybe what assistance the doctor will need as he's working with the patient. And here again are the treatment plans. Again, I can't make any changes to the treatment plan. I can't mark items as complete or make any changes to what's already there. As far as the values here in the treatment plan, I would actually have to go to the medical record if I entered in, for example, the wrong value for the pulse respiration temperature. So again, it's just that overview, again, of what is going on with the patient while in your care. And if I go to the checklist item, I can simply, if whatever is done, just simply the operator can come here, select the options, and then go ahead and close the episode. Or if everything is checked off the list, the invoice can be concluded and will automatically close the episode if you have that setting turned on. So here I will just minimize the episode of Care for Tank, and I'm back to my screen. Now what I want to do is switch to Easy Time, because I do have a patient here that I want to check in. Now what I did, and I'll show you again the setup screens when we look at episodes of care setup. What I did is I created an Easy Time status of episodes of care. My feeling was, for example, just from personal experience, I had taken one of my dogs into the vet, I think for an ear recheck. I was probably in there less than 5 minutes. So I'm thinking, do you really want to create an episode of care for something like that, or do you want to use the episode of care for something where it's a little more, there's a little more treatment involved with the patient? So I did create a status type and it's a check-in status type of episode of care. So now let me check. That was Rogan. So now Rogan is checked in and the episode of care was automatically created, because with the episode of care setup screen, that's what I defined as a status to automatically create the episode of care for me using that status type. I also did it with boarding, just to show you. I did go into my boarding status type and basically did the same thing. So if somebody is coming in to the clinic will be coming in maybe for hospitalization and under the boarding module, I also did that, created a status for episodes of care in that situation as well. And in some of these areas, we're looking, like I said, as I pointed out, Nemo, it shows me where Nemo is in exam 2, Tank is in surgery, here's Rusty in exam 1. So by using clinic census, I have it set up to use the clinic census locations to indicate where the patient is while in the hospital. I do want to point out that as you get a lot of episodes of care on your screen, you have your search filter here, and I'm just hiding and expanding it. And here I'm basically looking at everything. It's in alphabetical order, or it could be in the episode of care number order. You can search for, based on who the current patient is, just look at their episode of care. I will kind of remind you about that. It saves the settings. So I had someone call up and say, this one operator could only see one patient's episode of care. And what they had the day before, they checked the option of current patient, and it saved that filter for that operator. So we just had to clear the filter so that person could see all the episodes of care. And here you can see you can look for an episode of care based on the census location or the reservation location or based on providers. And then you can also look if you're going to have episodes of care open over, different days. You could certainly do it based on the start date. And then here by invoice amount. You have then the apply filter option, and again the clear filter to go back to the default settings. On the history tab, and I think I only have this one patient out here in my database, but again, here's the history, and again, you can use your search filter to search for an episode of care. But what's nice again is you can open the episode, view again what happened with this patient while in your care during that specific time. So again, I don't have, I think, any medical records for this patient. But again, it would only show the medical records, the treatments that were done, invoice items for just this episode. So you're not looking through screens and screens of medical records or having, wondering what was actually done as far as the treatment plans go and who worked on it. You're looking at, well, who worked on this patient during that episode. Let's take a look at the setup screens. So I'm going up here to medical records and clicking the lower half of episodes of care, and I'll start with the canned checklist items. So here's where my medical record SOAP is and my update weight. And let's go ahead and add. So let's say we do typically the TPR, but I'll just do temperature. And here's the option to automatically add the checklist item when the episode starts. So I will leave that unchecked, but I'm going to go ahead and do save and new. And then I'll save and close. So those are my checklist items, my canned items. So now if I go to, I'll pick on this patient. If I go to add canned, so there's the pulse, respiration, temperature, so I can add those without having to type them in. So those were your canned checklist items. And on the settings tab, so here's where I have it set up that if my easy time appointment status, and you can set it to whatever you'd like. If you want every appointment to be added to episode of care, make it your checked-in status type. For me, I just selected episode of care. The same with my boarding reservation and for my census location. So in other words, if somebody checks in via census, I just have it set up as the check-in location. I do have this check to automatically close the episode of care when the invoice is concluded if all checklist items are complete. So that's the big deal. They have to be marked complete. And my default location is set to the census, and my default status is set to the census. So those are really the only options as far as setting up episodes of care. So I believe I did, and I can tell looking at the checklist tab, tank, let's say tank is done. So I could go to my invoice. And I need to make tank my active patient. There we are. So I'll go ahead and just conclude this invoice. Oh, I have a couple of tasks on the treatment plan. And I'm not going to, and again, I put some items out there on his treatment plan so we could see that in the episode of care. So I'm going to go ahead and close those and remove them just to conclude the invoice. We have quite a little balance out there, so I think we'll just go ahead and let's earn some cash today. All right, let's see if we got him removed. So Tank is no longer on the episode of care as he got removed. Now let me pick on Rusty. He's only got one checklist item. So as long as I mark the checklist item as complete, I can go to the status and close the episode. So there you have episodes of care. They can, again, it's just that virtual overview, virtual screen, menu, whatever you want to call it. That again gives an overview of what was happening with the patient while in your care during that particular time. The question is, can you conclude an invoice without completing the checklist? Yes, I can. I was able to conclude my invoice, and Rogan is still there because that checklist item was not complete. Any other questions? Good questions. As far as the number of episodes of care that you can see on the screen, it's going to be however big your monitor is, and so you will have that limitation. Let me just expand this. And of course, you're going to get the list expanded like this. You'll see your list of patients here on the side, and I can double click. Keep in mind you have the search filter. So if you want to search here, I can search by the current patient, or so if you're looking for a particular patient, that can be helpful. Is there any connection to travel sheets and tasks? Not with this. Again, as far as travel sheets go, if you're using that to move items to the treatment plan, to the estimate, to the invoice, then you will see those items appear, in these areas. So there's nothing directly, again, whatever you're doing outside of episode of care, you'll see in the episode of care. As long as, like I said, it's part of an appointment, an estimate, an invoice, medical record, treatment plan. So if you're using travel sheets and you're moving items to, again, the estimate, invoice, treatment plan, you'll see those items show up here. Okay, another question. Can you edit the amount of information that is in each box? Well, when I look at whatever is here, it's again based on, and I don't have a patient with a medical record that I created today. It's based on whatever is done during this time frame. So if, let's say, Lennox is here today and tomorrow, whatever information I'm going to see, especially invoice, medical records, treatment plans, I'm only seeing what happened in that time frame. As far as the status, this is all hard-coded, so I can't really change anything. Oh, okay. So the question was, is task and treatment plan basically the same thing? Yes. So if you're doing treatment plans, any tasks that you're creating within the treatment plan, you will see here. So actually, I can pull up, let me go back to history, and let me pull up Tank. So these were the tasks that were completed with Tank in treatment plans. The question was, does this information in the episode of care get automatically inserted in the medical record? Now again, what the episode of care is doing, it's pulling the information from the medical record. So when I create a SOAP, when I create a form, if I'm doing invoice items, let me go back to Tank again. So the episode of care is pulling what's entered in the medical record. It's just showing me what happened there. The episode of care isn't really creating anything at all. It's just pulling information from other areas of Infinity. Another person has the question, why would someone put something on the checklist and not the treatment plan? Little confused about the interplay. Again, I've talked to other clinics that they might not be using treatment plans. Again, maybe I'm coming in for a brief ear exam or something. It's not something that's really going to go on the treatment plan, but they want to make sure that the doctor enters in all the medical record notes and that it's completed and saved and into the patient's basically updates the patient's medical records. So they want to make sure that that quote unquote paperwork is done. So again, they might not be using treatment plans, and that's where the checklist comes in handy. Okay, another question, the activity task under treatment plan and task under EOC, are they the same? Just quickly go to treatment plans. I'll just add one real quick here for Lennox. Oops. Is there anyone here who hasn't really seen the new treatment plans? I just quickly added some tasks here. So looking at 3 p.m. I have again, the monitoring, the pulse and respiration. So let me add an activity for a walk. We'll look at this. Okay, so those are the tasks showing up from the treatment plan. Okay, so let me just recap again. Yeah, if you want to create an episode of care, you can use the buttons up here and just manually add an episode of care for a patient. Otherwise, like I did, I set mine up so that I have them set up as a status type, a check-in status type for my boarding and easy time. So that automatically created the episode of care. That was my personal preference. If you want to create an episode of care for every appointment that's checked in, just use your checked in status type. And of course, expand to work with this, and you can modify, again, the visit reason. You can enter in your own visit reason, otherwise mine pulled from my appointments. And here you can customize the estimate, or you can go to the estimates tab. If there's an estimate there, check which one, or you can have multiple that you'd like to show on this screen. You can modify the date and time. So let's say you started adding treatments and invoice items and things like that, then you realize you should create the episode of care. If it doesn't pull everything that you started, certainly click this button and modify the open date and time. Your checklist items, you can manually add or create the checklist. Again, you can manually add providers and referrals, or they will be automatically assigned as you create like a medical record or added items to the invoice. The providers will show up here. Your appointments, open estimates, open invoice items, again, any medical records that start during this time frame, and of course your treatment plans. So if you do have any questions, of course, more about the episode of care as you start working with it, feel free to contact our customer support. Keep in mind, again, it was just an interest. One individual couldn't see all the episodes that everybody else had because their filter was still on current patient from the day before. So make sure you've maybe cleared the filter, or you're looking at specifically the patients that you need to. All right, thank you, and enjoy the rest of your day.